Hello, I am Kristen Dempsey. Good afternoon, and welcome to the CIBHS Peer Leadership Institute webinar series. Today's webinar, Cultivating Peer Leadership, Supervising Peers Working in the Public Mental Health System, is the second webinar in our webinar series for peer supervisors. Joining me today is Kelly Bitts, who will now introduce herself.
Hello, this is Kelly Bitts.
Great. Thank you again for being here today. And we will go ahead and get started with our first presenter, Terry Byrne, who joins us from Mental Health Association of San Francisco.
Hi, thank you so much, Kristen and CIBHS, for this opportunity to participate in this webinar. I wanted to tell you a little bit about myself, and then I'll have my cohorts, my co-workers here introduce themselves. I am working with Mental Health Association of San Francisco in another OSHPD funded program we call Propel, and I am the Mental Health Recovery Programs Manager. My experience has been about 35 years in the mental health field. I have been in the field so long that I remember the days when we used to give out medication and people asked what it was for. We said sleep. I mean, that was a long time ago. Fortunately, things have changed a lot. I worked for a nonprofit for many years, and the first time I worked with the peer counselors from peer certification programs was in 1995, so exactly 20 years ago. Then starting in 2006, I started working with Inspired at Work, doing mental health recovery education and training throughout San Mateo County and Santa Clara County when they first hired peers in their mental health workforce. And I worked along with staff preparing them for the peers that were coming down the pike and for the peers to orient them to how to work in the mental health system. So that's a little bit of my background, and that I would like to now pass the baton to my esteemed co-worker, Julie Tees.
Hi, everybody. My name is Julie. I'm the Propel SF Program Coordinator at the Mental Health Association. A little bit about my background. I spent a good portion of my life as a mental health consumer, struggling with extreme emotions, and I wasn't really able to work or do a lot of other things to care for myself. And after I found behavior therapy, I decided to go back to school a few years ago. And since then, I was working with the Warm Line here at the Mental Health Association as a peer counselor. And last year in October, I was promoted to the program coordinator here. And I've been doing that for a couple of months now.
Great, thank you so much, Julie. Next, I'd like to have Derek introduce himself. Derek Williams.
Hi, my name is Derek Williams, and I'm the SOLVE Senior Facilitator. SOLVE is a stigma elimination program, and we provide workshops at schools and nonprofits and do CIT trainings to talk about eliminating and challenging stigma and discussing wellness and recovery in the mental health community. I taught at a Quaker boarding school for 2 years and taught college English for 13 years. I am a consumer, and I struggled for a very, very long time not being diagnosed for about 20 years. And it wasn't until I came from New Jersey to California that I was diagnosed and got the help that I needed. What I do want to say is that I was a presenter in SOLVE, and now I am the facilitator, so I've gone up in the ranks, and I'm very excited to be doing this work. I was also the vice president for a year and the president for about 6 months of the Depression and Bipolar Support Alliance, the San Francisco chapter here. And so I'm very invested in the work of mental health and recovery.
Thank you so much, Derek. And next, I'd love for Tracy Helton from the San Francisco Department of Public Health to introduce herself. I don't know where Tracy went, but I will tell you a little bit about Tracy. Tracy is the manager of in the San Francisco Department of Public Health, we have a peer respite called the Hummingbird Place. And Tracy has been a manager in the San Francisco mental health scene for about 8 to 10 years now. And when she comes back, she might be here now.
Can you hear me now?
Continue. There you are. Yes.
Okay, sorry. I messed up the meeting function. I'm
No
Tracy Helton, and I work for the San Francisco Department of Public Health. I'm a peer contract manager. I also run the Hummingbird Peer Respite, and I run a program focused at trans women of color who are interacting with our mental health system. So I have been working as a peer supervisor in various locations for around 16 or 17 years. So I used to run a program here in San Francisco called the SAGE Project, and also been the manager of when the MHSA first rolled out in our county. We had what was called the Consumer Employment Program, which was our use of the consumer and family members in the county mental health system, working not just as in clerical functions, but also our beginning of working as counselors. So that program became very large and was eventually contracted out to another agency called BRAM, and now I'm their contract supervisor, and I am also a consumer of the mental health system and worked my way up through the ranks to the position that I'm at now. Thanks.
Thank you so much, Tracy, and Derek and Julie. So that's a little bit about us, and right now we'd love to know who is in our audience. So if you could take a few minutes and answer the poll question, excuse me, let us know if you are a supervisor of peers, if you're a peer working in the mental health workforce, or if you're a family, caregiver, parent, employed, or volunteering in the mental health system. Excuse me. We don't have any exciting music to play in the background. I apologize.
Okay, I just closed the poll, and it looks like we have 20% are supervisors of peers, 80% are peers working in the mental health workforce, and 40% are family members or caregivers or parents employed in the public mental health system.
I forgot to turn on my unmute. That's fantastic. Thank you so much. So 20% are supervisors, 80% are peers working in the workforce, and we have 40% are family, caregiver, parent, employed, or volunteering. All right, that helps us to know who our audience is. Great. Excuse me. I also just wanted to let everybody know I'm on the tail end of that bronchitis thing, so I will try not to cough in your ears, but just forgive me if I have to vanish for a moment or two to cough. Okay, so we wanted to reinforce the objectives that we advertised for today for our webinar. And so our objectives are: we're going to identify challenges that peer workers face on the job. We are going to offer practical tips on how employers can support peer workers, and discuss ways peer workers can manage up and get what they need from employers. So we wanted to ask, or actually, I'm sorry, next, wanted to see if people have any questions, if there's anything else that you wanted from us. If there's other things that we might be able to cover for you. Take a minute maybe to type that up. Excuse me. Okay, so I don't think there's any, it looks like everybody's satisfied with what we're going to present. So Julie,
I don't have any new questions.
Okay, fantastic. Looks like we're going to cover everything then. Julie Tees, would you mind reading the next slide here for us?
Absolutely. So the value and importance of peers working in public mental health system. It reduces stigma. Peers working alongside clinical professionals reduces public, structural, and self-stigma. It promotes recovery. Peers share their lived experience and model recovery for their community. It transforms systems. Peers help broaden options for treatment and create better outcomes. And it supports personal wellness. Peers who are able to use their lived experience on the job may feel better supported in their wellness.
Great. So we wanted to spend some time talking about the outcome of these values when they are happening. So the outcome of reducing stigma. I'd like to, also people chime in if you can let us know what you think about how does having peers in the workforce help reduce stigma. One of the things that we know from our stigma work here at Mental Health Association of San Francisco, and Derek can certainly talk more about this, is one of the things that we know is a fact is that with the reduction of stigma, especially in the mental health system, more people would access treatment. That there's a very strong feeling out in the community that mental health, the mental health system can be very stigmatizing. And so by reducing stigma, having peers, modeling and showing the public that people with mental health challenges can and do incredible work, we can reduce that stigma in the community, and more people might come in for treatment. We know that the second leading cause of suicide among college students is suicide. So by reducing the stigma, by having peers working the mental health workforce, we can reduce the number of suicide attempts and suicide among college students. Excuse me, Derek, would you like to talk a little bit more about some of the structural stigmas that the outcomes of having peers in the workforce might?
Sure, I'd like to talk about that. When I speak in the presentations and we talk about structural stigma, we normally talk about systems of power. We talk about institutions, laws, and policies that give people rights or access to services, or take away their rights and don't provide access. Some examples of power structures that may uphold structural stigma, meaning denying rights and privileges, might be housing, employment, healthcare system, even including the mental health system, unfortunately. Criminal justice system, there have been some problems there. Public policymakers, not knowing, not being fully aware of what's going on in the community. The media, movies, newspapers. Family is actually a system of power, culture, and religion. And stigma that is inherent in policies in public and private institutions that restrict opportunities for individuals with mental illness, or the way stigma gets worked into systems. Sometimes stigma shows up in these systems. Negative attitude.
So thank you. Right. And so the value of having peers working in the mental health workforce is, I've seen it myself when I would go with someone to, also I forgot to identify myself as a peer and also as a family member. But when I would go with someone to find housing, and when the landlord would look at the Social Security as the form of, or the source of income, and say to the person, what's wrong with you? You look fine. And then the landlord would be reluctant to rent to an individual who identified as having a mental health challenge because they felt like they were not going to be a good tenant. The outcome of the education system, as we know, especially colleges. I just saw an article the other day how there's a huge 50% of students in college campuses, community college now identify as having mental health challenges and needing, more counseling. So I know that, and maybe Derek, you can speak to this since you were a professor in a college.
Yeah.
But the idea that if people come forward and talk about having depression, many times they are let go. They're what's the term for when you have to leave school? I can't think of it.
Can either.
Yeah. Anyway, I'll let you, if you want to talk about that.
You're actually invited to leave. You're invited to leave. That's the polite term. But you take it's academic probation, and then you have like a semester to prove yourself, and then if you don't, then you're invited to leave the institution. But could I just speak to how students, to the point that you made earlier about students, just real quickly, sometimes we see students who have erratic behavior. They don't show up to class, or they do, and instead of asking, what's going on, is something that we should know about. A lot of times these students are punished, penalized, graded, and dismissed as just being poor students, when actually there's something really going on underneath. And we did a presentation yesterday at one of the colleges here in San Francisco, and a student came out and just shared his mental health challenges and how it does affect his performance in the classroom. And it was a real courageous moment, a real powerful moment. So it does, these things, our students are going through a lot, and they need the support that we can give them.
Thank you. That's a great example. That's a really great example of how the strength of having peers, people with lived experience, working in the public mental health system, and able to say, yes, I have a mental health challenge, and be proud and strong, and empower others, and to show that there's no shame.
Yeah.
Yeah. Right. Thank you so much. The other one of the other outcomes one of the other outcomes of having peers working in the mental health system is that it promotes recovery. And I know, Julie, you had a nice story to tell us about that.
Yeah, so I've been denied treatment based on my diagnosis. So there's quite a bit of stigma within the mental health system itself. But when I finally was able to find the appropriate treatment for me, and actually find people who were willing to listen and understand what was going on and try and help me figure things out, things really started changing for me. I was able to go to school where I felt like I was more a part of a community there. And just the act of going to school for peer support helped me to understand my own diagnoses better, my own struggles better, and to be able to better self-advocate for myself. For years, I was never given the option to determine what was best for me. It was always decided for me by other people. No matter what I said, I felt was the right thing for me, or what I didn't think would work. And then when these things would fail, it would be my fault, and I would be further stigmatized because of that. But after going to school, I started working at the Warm Line, and things really started changing for me then, because I was no longer isolated. I spent a lot of time, by myself because of my symptoms and people not understanding. I didn't go out in public very often, and being able to hold a job and to be there for people who are also struggling helped me to get outside of my own head, to remember to take better care of myself, to be more compassionate not only with others but with myself. And I think that the peer movement is really powerful, because we're the experts on ourselves, and we need to have a self-determined life. And for a long time, I wasn't allowed to have that. But now that I do, I'm able to grow and to, to blossom, I think, in what I'm doing.
Beautifully said. Beautifully said. Thank you so much. As you were speaking, I was thinking, I know in our Solve program, we have people come in to learn how to tell their story of struggles that they've had, as well as their road to recovery and some of the stigma that they've experienced. And people stay for about a year with Solve, sometimes a little longer. And we used to feel bad about that, but then we realized most of the people go on to most incredible things. And we give evaluations every couple of months to check people's self-stigma, and leaps and bounds. When people come in, many times in the first class, they'll be like, wow, this is fantastic. I've never really been around so many people, that were openly talking about, their mental health challenges. And by the end of the training, the evaluations, that show, scale of reduced self-stigma really improves by 50, 60%. And then after their first few presentations out in the public, it's like 100%. It's across the board. And usually people have gone on to amazing things, including both Derek and Julie, who are now, supervisors and managers of programs. We have had so many people that went on to get their master's degrees, other people who, got their first volunteer job. I mean, people have done amazing things. And it really is about seeing other people with, challenges working and managing and working it out. So thank you so much. Some of the other outcomes is transforming systems. And I think just for me, in my experience and seeing, the last 35 years, how I think the main thing I see is choice. That people now have choices, we hope, that I remember in the days when we would decide what groups were going to happen and what your treatment plan was going to be and where you were going to live and where the person was going to, what classes they were going to take. And I remember working in a halfway house, or it was called a halfway house, and a young person came up and said, me and Joe want to go get an apartment. It's like, no way. You guys are not going to make it. There's no way. I mean, we were just so paternalistic. And so just having more peers at the table, people with the experience being part of the conversation, telling the system what works, what doesn't work, is huge. And I don't know if anybody else had anything to add to that. Nope. Okay. And then I think, Julie, you were going to talk about how it supported your personal wellness.
Yeah, like I said earlier, for a long time I isolated myself to kind of hide my symptoms from people, and because nobody understands, and people wouldn't want to hang out with me if they saw me have extreme emotions that they didn't understand. So it's really helped me to feel that I have a life, I have purpose. I'm helping other people, which is a huge part of why it makes me feel better. That's kind of why I got into this, because when I finally found something that worked for me and helped me to feel better, I wanted to share what I felt that was the magic of that with everyone else, because it was such a transformational point in my life. I had no hope until then. I'd never understood what hope was because I'd never experienced it. So that also helps me to get through the tough times now, because I know that things will get better, and I can tell myself that during a hard time where I didn't know that before because things had never been better for me. And to be able to share that with other people who are struggling, and to let them know that, no matter how much you're struggling now, everything changes. Things will get better. No feeling lasts forever. That's one of the things I have to tell myself quite often, is this feeling is not going to last. I'm going to feel differently in just a little while. So being able to be there for other people and just help them and to give them hope, I think, is one of the biggest things that helps me remember that there's hope.
Thank you for saying that, because I think in my experience, as I said, in the early days of my career, I was told, I just followed whatever, I was taught. The clinicians and the system said, don't get a job, don't stress out, just take your medications, take it easy, and you'll have, probably have a life of coping and, maintenance. And as Pat Deegan talks about, when she was told that at 18, like she didn't look forward to a life of coping and maintenance, that she wanted more for herself. And so I think that this is the other thing that peers in the workforce have brought to the system, is that sense of hope and that sense of, the reality of hope, that recovery is a reality. So I thank you for that, Julie.
So if I could chime in, I think one of the other things that peers in particular bring is a real robust knowledge of what is available in the world. That, I think about my own experience. Like when clients come in, they have, sort of a deflated sense of themselves because they've had some kind of, particular episode or thing that's happened in their life that they may not understand. And so when they get to the point where they're actually peers, where they're talking among other people like themselves, they start to, it fosters a sense of hope, but then they also get information that the clinicians cannot provide them with. So some things as simple as, this place isn't open on Tuesdays. We've seen so many times where the case managers will refer people to programs that are closed, or they'll refer people to a place that isn't necessarily a good fit for them. And the peers can step in and say, well, in my experience, this is what I know about this place, or this was my experience trying to go to the Department of Rehabilitation. Like in San Francisco, the Department of Rehabilitation is not close to any of the other services. You have to have a California ID to sign in. It's not necessarily the most friendly location. So that's something that a peer counselor or peer leadership can really step in and help with. So it reduces the stigma, but it also creates a sense of community, and it also creates an opportunity where people who are having common experiences can then support each other through a process, because it's very, very frustrating if you're already having severe depression or anxiety, or you're hearing voices, and then you have all these barriers to getting help. And so what the peer workforce does is it helps relieve some of those barriers, and it's good for the person who has the peer job, and it's good for also the people who are having to access the system. So it's really a win-win for our county mental health system.
Thank you, Tracy. That's a really good point, because I think that really shows and helps me to define it for people who still don't really understand what is this thing, lived experience. And what you're talking about is lived expertise, is that, yeah, I can be a social worker and I can refer you to that center over there, and that's where the people go for this, and I can send you over here. But somebody with lived expertise, peers with lived expertise, are the ones who have who stood in that line, who have waited, who have been turned away, who have had good experiences or not so good experiences. And that's what the lived experience is, as opposed to somebody who has resources and can make referrals. So I think that's a great point. Excuse me, I'm sorry.
Gary, we have a question here.
Yes.
Somebody has asked if we could talk a little bit more about transforming systems.
Yes, we are definitely happy to talk about that. So in terms of having peers working in the public mental health system, I think, as we talked about, having peers at the table, where peers are actually have, especially since the Mental Health Services Act, where it was mandated here in California that we need to have people with lived experience at the table helping us make decisions about all kinds of things. And so that has helped transform systems. I mean, you would never see peers. I did 20 years ago in 1995 when we started to hire peers where I worked, but I've worked other places where it's unheard of, and still, I'm sure many of you have seen that there aren't that many peers at the table. I mean, I know several programs here that are supposed, working with peers and peer education, et cetera, here in the Bay Area somewhere, and there's not that many peers involved. So it's really important.
If I can speak from a county level, so when I started in the county mental health system in 2008, the traditional jobs for peers were the three F's: the floors, the filing, and the food. And so when it came to implementing different sections of the county mental health plan, we would they would have meetings. They had a client council, or they would have feedback. But in terms of actually participating in the decision-making process of the county, the input for peers was very, very limited. So then the San Francisco County started implementing different pieces of the Mental Health Services Act. And so what happened with that is as time went on, we said we needed more input in different parts of the system. So we then got peers onto different committees, all the way up to our executive committee. We had people involved in different parts of our RFP process, our RFQ process, when different funding allocations were going out. We hired peers for different sections of the, and as just opposed to sort of service jobs, actually working directly with clients. We encouraged through our education programs for peers to go through and actually become clinicians, and we also encouraged peers then to rise up and actually be in management roles. So it really, and there's a lot of stigma involved in our system. I'm not saying that we don't have a lot of room to grow, but I think we've made, a considerable process over the past few years.
Thank you very much, Tracy. Does that answer the question? Okay. All right. Thank you. Then, okay, so we'll move on to our next slide. Which is, what is peer support? And Julie, you were going to speak to this.
Yeah, so what is peer support? This is kind of a wordy definition, but I think it's pretty accurate. It's a relationship of mutual learning founded on the key principles of hope, equality, respect, personal responsibility, and self-determination. It's therapeutic interactions between people who have a shared lived experience. It's empathic understanding of another's situation through the shared experience of emotional and psychological pain. It's a relationship without the constraints of the traditional expert patient or expert family member role. And it's a service that helps people with behavioral health challenges to lead a longer, more satisfying life by promoting recovery, wellness, and healthy lifestyles, reducing identifiable behavioral health and physical health risks, and increasing the healthy behaviors that are likely to prevent disease onset.
Great. And then did you want to talk about some of your experiences being a peer supporter and what that's meant to you?
Yeah, like I said earlier, being on the warm line and taking calls from people who were in not in crisis but in distress was really rewarding for me, and it taught me a lot about myself. It helped me to think about myself in a more empathetic way. It also helps me, like if I see somebody out on the street who's acting in a way that people find strange or, is maybe yelling or different things, instead of just being afraid or, wanting to get away from them as fast as I can, I find myself wondering what's going on with them and, wishing that I could help them. And when people call in and I would talk to them, like I could be having a really bad day. There were times when I would be really upset, even crying at times because I was struggling so hard before my shift. And I would think, oh, I can't go in. I can't talk to people. I can't do this. And, my feeling of responsibility would outweigh that. And I would go in anyway. And within a few minutes of talking to someone else, I had completely forgotten about how rough my day was, about whatever was upsetting me. So not only was I helping other people, but they were helping me by allowing me to get involved in what was going on with them and to listen to them and hear what they had to say and just be there for them in a way that I don't think a lot of people are for them in their lives. We all have friends and family members that really care, but it's not very often that we have that intentional sit down and I'm going to hear what you have to say, and I'm really going to listen to you, and I'm going to offer you empathy, and I'm not going to just say, oh, shake it off, or, get over it, cheer up. I'm not going to say any of those things. And so being able to offer something to somebody that I never had, I think I mentioned the word magical before. It feels very much that way to me, because I grew up in the mental health system that Terry talked about earlier, where you take your medication, you do what you're told, and you just be quiet. And so this is so much different than that.
Thank you so much, Julie. One of the things I wanted to say, too, with my experience working with peers and seeing that incredible transformational relationship is, I think back to many years ago when the agency I worked with, we first hired people with lived experience to actually go out into the community and visit people in their homes. And some of the tasks that they had was to, check on people and look at their medications if they were taking meds and make sure they were taking them right, if they were choosing to use them, and that was language that we used. Not controlling, like make sure he takes his meds. It's like if he chooses to take his medications or to use medications as a tool, just make sure that, the medi sets are set up correctly and, the person's doing it right. And the conversations that happened around this were just really changed my, my life dramatically. To see somebody who, when I would visit people with, my clients in the community and talk to them about medications, it was a us versus them thing. But when a peer who had taken meds went in and said, I know how it is. I've been through periods where I didn't really feel it was helpful, or it was really helpful, or I've had some medications that caused some serious side effects, and it was unfortunate because I really wanted some relief from some of the symptoms I had. And just having a conversation that was mutual was really beautiful to watch, because there was no power struggle. There was no somebody's trying to make me do something. This is somebody understands me. Somebody's been there, and I can actually honestly talk about it. Where I know so many people say they don't really have many honest conversations oftentimes with doctors or clinicians. So, that's one of the other beauties I see in peer support.
Yeah, I'd like to make a comment about that. When you talk about being honest, as somebody who spent about 30 years in the mental health system, usually against my will, I learned real quick what to say and what not to say. I knew what I could say that would maybe get me help, and I also knew what to say or not to say that would get me, put in a hospital against my will or forced on medication against my will. So I think the idea that there are people that you can be honest with also opens up for better care for people, because if they can tell you what's really going on for them, you can help them overcome that a lot easier than them not feeling safe with you and having to try and just figure it out for yourself or leave them to figure it out for themselves.
Yes, thank you.
Yeah.
Anybody else, Tracy or Derek, do you have anything to?
Yeah, I wanted to make the point that that what Julie has said is really it hits it on the head. Peers are not empty vessels. We come with a lot of experience, life experience. We come with a lot of talents. We come with instinctive gifts that make us fully human. And I think we bring that to the table as well in our relationships with other people, not just our experience of mental health challenges, but the gifts that we have as a person. And that sometimes is overlooked because we're looked only as our challenge or quote-unquote illness. But it's really important to remember that peer, which is a peculiar term, but the word peer, that we know in many ways we can be healers as well and cooperate along with the healthcare professionals, cooperate and work along with them because we have something very unique to bring to the table, just as human beings, just by being who we are.
Thank you, Derek. All right. I wanted to give credit, because I don't think we have a slide for this, giving credit to the 2014 CASRA Peer Provider Toolkit for some of the materials and the definitions that we're using in the PowerPoint. So I just wanted to be sure to say that before I forgot. All right, thank you so much. So next slide, we want to pose a question to you all. We have, what do we have, 80% of our audience is, let me see, what did we say? We had 80% is our peer providers working in the workforce right now, so that's fantastic. We'd love to hear from you, like what, and also everybody else, what challenges do you see peer workers facing on the job? If you're a supervisor, what challenges do you see? If you're a peer worker, what do you see? And if you're a parent or a volunteer in the system, tell us what challenges you see. We're going to hear from you first, and then we have a list that Derek will read off to us in a few minutes.
I just want to remind the participants they can go ahead and enter those questions in the question box of what challenges they see. I do have one, not enough opportunities for professional development or career advancement.
Great, not enough ops. Okay,
Opportunities
thank you.
And then now they're all starting to come in here. There is no living wage in the Bay Area for mental health peers.
I'm sorry, no what?
No living wage.
Okay.
Peers have a lot of insight. They are not utilized as much as they should be, and they had asked the question, why?
Okay, great.
So it looks like those are the questions we have right now.
Okay. These are great questions. Let's pull up the slide. We have identified some other challenges, and we can talk about these. Derek, would you like to lead this?
Sure. Challenges facing peer workers, lack of understanding of the peer role in the workforce, lack of employer support, supervisor not fully aware of peer role, abilities, lack of clearly defined roles, insufficient training, including peer certification, limited opportunities for professional development or job advancement, tokenism, scapegoating, us versus them, being treated like a client, not a coworker, stigmatizing language in the workplace, inclusion, not being invited.
Thanks, Derek. So let's see, lack of understanding of the peer role in the workforce. I think that is because many times I've seen it myself where sometimes systems, it's like, okay, we're going to hire a peer, and really not understanding, you know, I mean, we just had a 40-minute conversation about what peer support is, what the role, what the value of, and many times peers are hired into the positions and people don't understand, you know, that role, so that can cause a lot of difficulty. And a lack of employer support, the same type of thing. And I think that would answer one of the questions is peers have insight and are underutilized, and why? That was the third question that one of our audience members asked. And I think that's, again, because lack of understanding of the peer role in the workforce. Supervisor not fully aware of what the peer role is. And I think, to be fair, many times supervisors don't get enough training. Anybody else have anything? Julie or Derek, did you want to speak to this?
Well, I wanted to share my experience about being in the workplace. Would this be the time to do that?
Absolutely, please.
Yes. I was working with an agency that tries to place peers in the workplace, and I had been on disability for about 3 years. Before then, I had worked 15 years nonstop, and it was very difficult for me to be on disability. A lot of self-stigma I was dealing with. But just to be to move forward, I think Tracy mentioned this too, the 3 F's, that a lot of the positions would involve food, filing, or floors, like janitorial work. There's nothing wrong with those professions. But they saw my background. I have a master's from Columbia University, and so I figured I'd be working with the administrative end of things. And they basically had me working as a stock boy, and I wasn't allowed to answer phones. I was constantly, my work was double checked. I was not spoken to as a peer. Actually, the other coworkers who did not know that I was a consumer treated me with a lot of respect, but the 2 supervisors who knew that I was a consumer spoke down to me as if I was a child, and were constantly asking me if I understood. Do you get it? Should you write it down? So it was very demoralizing, and it made me feel worse going in. For worse being there than going in. And so for my own survival, I had to leave because it was an unhealthy environment for me. But it was very stigmatizing. And I don't understand why they felt I was not able to take on other responsibilities. My role was not clearly defined. I was kind of just like a guy who does everything. And I have 15 years of valuable, extensive experience, and I wanted to make a contribution to the job that I was working in, and I was not permitted to do that. So, again, as I was saying, we're not empty vessels. We come with our own experience and expertise and knowledge, enthusiasm, ambition. And it should be honored and respected and utilized.
Bravo. Thank you. Great example. I wanted to talk about the last one here. We have inclusion and not being invited. And I've seen a lot of that also. One example is worked with a peer provider. Actually, she was doing one of the 3 F's. She was doing filing. But the clinical or the administrative staff would go out, say, for lunch every Friday, and this young person worked maybe 10 to 2, and so she always felt left out because nobody ever really invited her. And so, I coached her on how to talk to the supervisor about that, and the supervisor said, it was that kind of thing where supervisors are not aware of some of the obstacles, and also sometimes peers are not aware that there's solutions to some of the obstacles. So I talked to her, and her challenge was she worked 10 to 2 or whatever her schedule was, and she only had a half-hour lunch break, but they all went out for an hour. So they didn't really invite her. And then the supervisor said, well, we can work that out. We can have you work an extra half hour and you can come. But it was, that could have just gone on forever because she didn't talk to the coach about, feeling left out. And I think that's really important is to, sometimes, supervisors, the word supervision, I love is it's really somebody who has supervision. It's kind of a superhero. So as supervisor, it's important just to be aware of some of those things. If people are not being included, looking at what the obstacles are. Is it their choice? Is it something else? But it's really, really trying to be aware of that. I know inclusion in a lot of things, when people have staff parties, I've heard people say, reluctantly, they didn't really want to have, that peer at their house. They didn't want that peer to know where they lived. It's like, well, talk about stigma, and, it's painful. It's painful. Any other comments about some of the challenges that peers face in the workforce? I can speak also about the stigmatizing language in the workplace. I have the experience of working with peers now that are working in a place where the staff were not really prepared and there was no real prep work done. And so, there's language used about certain diagnoses that is very stigmatizing, really difficult, manipulative, describing people like this. And some of the peers working there, had some of those diagnoses maybe at one time, feeling very, stigmatized and, reluctant to share anything about themselves if that's the way the staff feel, So I think, really helping, peers to be able to, really being aware of the language that we use in the settings is so important. I'd like to recommend for everybody, there's a wonderful article that actually Kristen Dempsey turned me on to a while ago, and it's called, you can Google it, it's called Stop Talking Dirty, D-I-R-T-Y, and put clinical article next to that, because if you write Stop Talking Dirty, you might get some other kind of article. Sorry. But this is a fantastic article written by 3 MDs from Boston, and they talked about the language that needs to change in our treatment centers, and especially around the substance use world. When you think of people coming in for treatment, and you give them, ask them to take a urine test, and we judge the urine as being dirty or clean. I mean, just right away, would you want to go anywhere, where people are looking at you as dirty and clean and judging you from that end? But it's a fantastic article and a great awakening of some of the language that we, been using for all of our careers and never gave thought to the fact that maybe this hurts somebody. If I was in a room with somebody using this language, maybe it would hurt someone to hear that, to hear themselves being described that way.
Terry, I'll get that link from Kristen and send that out to all the participants so they don't have to worry about trying to find that. We did get a couple more comments here. One person asked if we could talk a little bit more about tokenism and scapegoating. And then someone else said that if we have a strong peer who is good at advocating for peers, they should be supervising peers. This would eliminate a lot of the stigma. So I think that's kind of a question and a comment.
Yes, I love that. That's great. That is something that I know. Is everybody familiar with the SB 614? That is the peer certification standardization across California. And I know that that's in some of the language is that it's much more effective to have peer supervisors for peers. In many settings, people who are not peers or people whose positions have nothing to do with what peer work is about are supervising peers, and that's really difficult. I mean, that's difficult for anybody, but I absolutely agree, and I know that that's part of what SB 614 wants to see happen, is that we start having more peer supervisors positions to supervise our peers. And then I think about tokenism. Does anybody else want to speak to tokenism? So I'm not.
I can speak to tokenism.
Please do.
So working in the county mental health system, it's really, really hard. It was very hard for peers to get a foothold. So what would happen a lot of times is we would have these meetings, and there would be one peer at the table, or there would always be a certain peer who was invited to different events. And then also with scapegoating, so think about it this way. If you've utilized the county mental health system, someone calls you a consumer. But if you go to Kaiser or private insurance and you have a mental health thing and you get put on medication, they just call you by your name. Hi, Ms. Helton. No one calls you consumer. You're not carrying around that label. And I think that it's really hard in the mental health system to get away from being labeled a particular thing, or also in the clinics, sort of blaming the peers in a certain way, or getting away from the thought of them in a clinical setting when you switch into being a professional. And it's a huge leap for some of the people who have been working with clients for a long time to then see people advance and come back and be, if they're not the same person, sometimes they're the same exact people, or they're different people, similar people coming back saying, I'm now a professional. So it becomes, it's a huge challenge, and we've had to do a lot of education over time with people to see that it can't just be one person that you're using as the expert, or inviting one person to the table. It has to be a whole systematic change where we're working collaboratively with each other. And I can say from my own personal experience, I was locked up 5150 here at San Francisco General, and now I run a program here. But that was a long upward hill to climb, and it's not easy to get to where I'm at. It's not easy to get to a place where you're, unless you go outside of the system to a certain extent to get education, respect in your field. But a lot of people say, well, I want to trudge through. This is the field that I've chosen. I want to trudge through. And it's a difficult process. So things have definitely progressed over time, but we need to go farther. And I really wanted to speak to the comment that someone made that there is not a living wage in San Francisco. I mean, one of the biggest issues we see with our peer workers is poverty. So when you give up your Social Security and you're on a certain income bracket, you're eligible for a lot of services. Well, then when you go back to work and you're working in some of these peer jobs, you're no longer, we have people who have these, you're no longer eligible for certain services. So how does that affect your medical benefits? How does that affect your housing? How does that affect do you have child care subsidies? Do you have subsidies for your transportation? So a lot of different things come into play when you talk about moving from, a person who's on, just working sort of a part-time job into working as a professional in a field where the pay is not necessarily that great. So that's something that a lot of the supervisors are not necessarily aware of, and we're trying to educate them about.
I think a lot of education has to happen with the supervisors. It's not just the responsibility of the peer to make the relationship work. And I think, the work that Solve does, the stigma elimination program that I work with, would be very helpful with that, and as well as other programs throughout the county. But I think the question that employers need to ask is, what contribution do we expect, this person to make, and how will they fit into our team? What role will they play? Do we value these people? Do we value this worker? And so, how we answer those questions really depends on whether or not being at that placement is a safe environment. All work situations may not be psychologically healthy for our peers to be in. I think a lot of our peers are put into unsupportive work environments that is somewhat triggering and makes their conditions quite worse, because they are experiencing not only their symptoms, but they're also experiencing stigma. So it's a double burden that's being carried. You have to carry the burden of stigma while at the same time manage your mental health challenges.
Well,
so a lot of education needs to happen with these companies. A lot of education.
One thing I'd like to mention too is, from my own experience, coming from never having really had a job before because I was struggling so much with my mental health challenges, to working in an office environment, was understanding office culture and some of the things, what should I do? Should I joke? Should I not joke? A lot of different things that go on in an office that people who have always worked in an office or maybe came there from college don't realize that maybe a peer doesn't really understand what's going on, because, from my experience going through a peer certification course, they didn't teach us about being in an office. They didn't teach us, Microsoft Word and Excel and Outlook and things like that. They taught us peer counseling and empathy and, things like that. So that was a huge obstacle for me, was trying to figure out, kind of where I fit in, what was acceptable to say and do, what wasn't, how things worked and things like that. So that was a huge challenge for me that I'm sure a lot of other people have struggled with as well.
Excellent. All right. Thank you so much. Julie and Derek, a little while ago we said, oh gosh, we might not be able to talk the whole time. And it's already 1 o'clock. So we're really enjoying this rich conversation.
Okay, great.
So as facilitator, I'm going to have to move us along because we do have a couple more important points. But anyway, so let's see. We have a question for the audience. If you could tell us, what challenges do you see? No, sorry. The next slide. Next slide. Next slide. Thank you, Kelly. How can employers better support peer workers? So if you have any ideas on that, please type up your answers, your suggestions. And Tracy, would you like to facilitate this part of the?
I can. I'm eating my lunch, but I can.
Great. So
are we taking a poll or are we taking questions?
Kelly is going to let us know if anybody types anything in.
So I think from the employer's perspective, we have, a far way to go supporting the peer workers. I know some of the things that we have done in the past is we've done everything from, asking people what they feel they need to be supported. We've brought in job coaches when there was issues with a particular workplace, because I think one of the things that we can train on is how to do the job, but one of the things we have trouble with is training people how to work in an office environment. And what I mean by that is there's certain nuances, there's certain things about switching and working in a particular office that sometimes the peers may not be aware of, the culture of working in a particular place, the languaging that people use in a particular place. And so that can be very intimidating when you're going in, for anyone going into a new situation. And then sort of in some places you might be the only person, you might feel like you're the only person like yourself in that location. So if I'm a peer in a large team of, a psychiatrist, a case manager, a social worker, and then I'm doing particular functions that seem different than what everybody else is doing, I might already feel isolated, but then also, working in this new office environment, do I pack my lunch? Everyone goes out to lunch. What am I doing with that? What am I, where around my breaks? Do I smoke? Or am I supposed, a lot of offices don't allow, you can't smoke anywhere near the building, and people feel stigmatized having to go outside. So there's a lot of different sort of, particularities to any particular job site that it's important to have peers be able to check in with each other. So one of the things that we've done is have, broader, larger peer support groups. We've had peer support trainings where people can meet with other people, other peers working in the workplace, and the employer has to make that time available for the peers to go out and do that. So one of the things that we say is that if we have trainings that are available, you, employer, have to make that time, paid time, for them to then be able to go out to that. So you can't go to every particular event, but we make sure that there's a certain amount of time where people are available to go to different things. We try to make it so the employer needs to make it so if there's reasonable accommodations that need to be made for a particular person, trying to get the employee to feel comfortable enough to explain after lunchtime, I take these medications and I'm very sleepy, and so I might need a few extra minutes to get myself together. So the employer needs to then understand that this is then a reasonable accommodation. It's not something that the person needs to be stigmatized around. And so there's two parts to that. There's advocating for yourself as the peer coming back to work, and then there's the employer's piece, which is being sensitive to people's needs, which is a requirement under the Americans with Disabilities Act. That's actually a requirement. So then another piece for better supporting peer workers is having the employers educate themselves as to what the peers do. So there's two parts to that. There's the not valuing the work that peers do because the employers don't understand it. And then there's the second piece of that where if I see someone and they're doing a really good job, what some of the employers tend to do is give people work that is beyond the scope of their actual job description. And so that has to stop. So if I'm hired as a peer supporter and then I'm giving them a bunch of extra work as a case manager and this person doesn't, the peer doesn't know how to say no, then that's a huge problem. I need to understand the scope of what a particular individual working within the team is doing. And another piece of that is not always calling on the peer as the person with the lived experience to tell their experience. So I might be having a day where I don't want to talk about my particular experience. So I've seen that over time where people defer to the peer, and the peer, that day might not, they might not want to be in the spotlight for their particular experience going to the hospital, or they might not be the expert in that particular situation. So peers need to have autonomy around our disclosure, and people need to understand that within the work environment. And then opportunities for advancement in education are very important. So San Francisco County has a few different certificate programs. One of the issues that we're having now is that they're competitive. So we have more people who want to get into the programs than actually have the ability to get into the programs. So I'm looking at this slide. So prepare the workforce in the workplace. So that's something the employer needs to do, understanding the power of language. So I'll give an example. So I run the peer respite, and we have a room that was specifically designed for clients to be able to go in, or guests, we call them guests, to be able to go in and relax. And so there was a lot of discussion about what to call that. Call the room the quiet room. And someone came and said, well, you don't really understand the connotation of the quiet room because that's where they give the seclusions and restraints in some of the facilities. So what we saw was potentially a good thing. Even with my peer experience, other people saw it as being a bad thing. So understanding the power that the language has. So the history of the consumer movement, understanding that, talking about the stigma. So there's still a huge stigma. It's hard for some of the peers to come back to work and go from being a client to a coworker. So understanding that the employers need to understand that. So having a peer liaison. So I know as the employer, sometimes it's been very difficult for people to come and tell me particular things that are bothering in the workplace. So at one point we had a peer liaison that used to do that. So having peers at the table, so really including peers in discussions, discussions at all levels when decisions are being made, meeting people with the right job. So one of the huge complaints I had early on was that if there was peer jobs, no matter what the skill set someone had, they would squeeze people into these jobs. It's like, but you have someone that has, they're a great artist, but now you want them to do janitorial work, or you have someone who has a lot of experience doing case management, maybe in another, working with people with disabilities or something different, but then you think that they should go into food service. So really matching people with the right job within the system, creating meaningful job descriptions. So that goes back to what are the things that I'm supposed to be doing, and then what are the things that I'm actually doing on a day-to-day basis. We had talked about continuing education, providing opportunities for peer workers to partner on projects. So like I said, naming the rooms in the peer respite. So that was something that all the different areas of the peer respite, that the peer workers instead of having a designer come in and choose what we thought everything should be, we had the peer workers come in and partner and have a meaningful role in that. So at the staff meetings, encourage stories of recovery work to be part of the agenda. So I think we all need an infusion of hope at our jobs, especially if you work in county mental health, and bringing those up. And everybody's experience of recovery can be different. So for one person, actually be able to ride the bus themselves is a huge achievement. Where to someone else, getting into graduate school is a huge achievement. So really, not ranking things according to what we think are important, but ranking things according to what is important to that person. So really having a client-centered approach, and then us as doing work in wellness and recovery, understanding that. So clinical consultation. So we like to have, as an employer, it's important to make sure that the peer staff get clinical supervision around particular issues, because I can say for myself, I get triggered by things all the time that happen. Something reminds me of my own personal experience, or I'm not exactly sure how to handle any particular situation. So it's just as important for the peer workers. And then also we had discussed a time release for medical appointments.
So we have some suggestions from our audience members.
Okay.
So ways that employers can support peer workers through education, changing mindset, to be more understanding, having trainings and ongoing education for peers to have opportunity for advancement, treat folks with dignity and mutual respect, having compassion and allowing time for crisis, doctor's appointments, etc. So a lot of the same things you just went through.
Yes, excellent. Thank you so much, audience members, for your input. That's great. And thank you, Tracy, for that rundown there. So we only have 15 minutes left. So we're going to spend probably the next 10 minutes on talking about what peers can do to get the support that they need. If you all would like to send us some of your ideas, and then Tracy will walk us through this next section. We got about 10 minutes, and then we'll start to wrap it up.
So how can peers get the support that they need? So understanding your value on the job is a huge piece of that. So you bring, no matter what your background, you bring an important skill set to this job. So in fact, a lot of peer workers bring, those sort of the cultural aspect. So maybe you understand that if you are from a particular community, you understand the community better than the other clinicians. You understand the different programming. You have particular skills. Understand and believe in your value. That's number one. Learning how to effectively use supervision. So when you meet with your supervisor, have sort of ideas in your mind, in particular, what you're going to talk to the supervisor about. And you have it be solution focused. Like, what are the things, concrete things that you think that you need? And if you have any particular suggestions of how you think that should be mitigated, then let them know. So if I take my antipsychotics after lunch and I'm particularly tired, and there's some concern about me seeming like I'm nodding or something at my desk, how about instead I work on the chart in the back, so I'm not sitting in the front, would be an example. Or if I have my psychiatric appointment that I can't miss, and my appointment is every Wednesday at 4 o'clock, can I come in earlier? Or is there some other accommodation? So telling them stating what you think the issue is, and then also potentially having some solutions would be something that could be helpful. And and it sounds reasonable. A lot of times you can get that, and if you can't get that, then ask them to get back to you about what they think they can do. Finding relevant opportunities that will enhance the work and bring it to supervisors' attention. So always highlight things that you do on your own, and also find things that you think that you need to go to. Well, I think I really should go to a motivational interviewing training. It's free. That's always a good one to tell the supervisors. It's free. I found this Excel training that they have at the local city college. I think it would really benefit me to go. Is there any way that I can have an hour off a week to go to this class? That's another one. Or there's a lot of different visions and voices training. There's a lot of different ones that you could potentially use. Joining network of peer professionals. So Terry had talked earlier about Propel. There's other networks of the CAMPRO. There's other networks of peer professionals. Join work committees and get to know the other staff, and them to know you. And that's an important one. Get allies within the agency, people who are going to advocate you, who understand your particular situation and what's going on with you. And it also would help reduce your own particular isolation wherever it is that you work, because it can be very stressful going back to work, the only person in a particular venue. Did we have feedback from the audience?
Nothing at this time.
Okay. Good job, Tracy. Under time, too. Beautiful. Do we have any questions from the audience or any, Julie or Derek, did you have anything you'd like to add about how peers can get support?
I want to say, I want to make a comment about personal disclosure. Part of office culture, people ask you, how was your weekend? What did you do? Where'd you go on vacation? And so people are always, it's part of the culture to, bring some part of your life and talk about it, your interests and hobbies and your family and things like that. My experience has been, I don't want to have to represent the mental health community, and I don't want to be a token. And if there's just one of me there, or just one or two of me there, I don't want to have the responsibility of having to know all the answers. So I think it's really important for people, it was important for me to talk to my doctor about personal disclosure. Luckily, I'm working in an agency where, we're doing advocacy for mental health, but for other people, it might not be safe to disclose to others their mental health condition, because to other people the terms like bipolar, schizophrenia, depression, these terms are somewhat frightening, and so there needs to be a little some thought, some careful thought, some discernment, some consultation about personal disclosure, because you want people to know you, but you want people to know what's appropriate. There's just some things they don't need to know. Yeah.
Thank you, Derek. Thank you for that. Julie, did you have anything you'd like to add?
No, not right now. I think
okay.
A lot of stuff was covered.
Great. One of the things I wanted to add to this was considering doing a wrap for work. We offered that here at in MHA a couple of months back, and we had a pretty good turnout for a while. And people really felt that it really helped, especially what people wanted to do was do role plays around triggers at work. And it really helped to present an issue. Like a common theme was, I feel like my supervisor doesn't have enough time for me. And so we did several role plays about how to ask for, more time with the supervisor. And as Tracy was talking about, how to, really effectively use it, come in with, your questions, but also maybe some solutions. And you want to really, get your supervisor to, to understand what you need. But Wrap for Work can be very helpful, and you can share it with, as much as you want with your supervisor, if you feel comfortable with that. But it really kind of lays out, what you can do on the job. I mean, a lot of us have our self-care things that we do, like hiking on the weekends, or going out to dinner with friends, or going to the movies, or doing meditation. But talking about what we need to do at work. For example, I have a meditation bell that rings every 20 minutes on my computer that reminds me to stand up and take a deep breath. If I'm having difficulties, if I'm being triggered, what's on my wrap plan is to check in with my coworker, or maybe go to my supervisor or go take a walk. But it's like these things that we need to do right away at work. It's not like I can wait for the weekend to go hiking. I've got to do something right now at work so I can get my job done. And a lot of us here at work have Wrap for Work, and it seems to be, very, very helpful. So we're good. We're at 1:20 right now. I'm wondering if anybody had any questions from the audience, any final comments from our esteemed panel, and then we can just wrap this up.
Don't forget
I don't
our video.
have any new questions.
And maybe while we're waiting for questions, can we show the last slide? We have a lovely slide that we'd like to share with you.
Can you wait to start the video for a second? Thanks. So, but before we start the video, I just wanted to kind of talk about, if you think about birds and you see maybe one or two birds hopping around, flying, you don't pay much attention to them. They aren't very attention grabbing. And so I like to think of those individual birds out on their own as us as peers when we're out on our own. Things might go along fine, but we're kind of out there by ourselves, and we're not accomplishing as much as we could as if we're together. And so if you want to go ahead and play the video now, when we come together, though, we can accomplish some really amazing things, and I think this video is going to kind of demonstrate that. This is called a murmuration of starlings, and they're kind of known to do this. They just get together and they make some really interesting and unique patterns when they fly.
And you can't take your eyes off of them.
Yeah. So I think that as peers, if we can come together and network and help each other become stronger and reduce the stigma, become more commonplace in the mental health workforce, we're going to be more like a murmuration of starlings, doing great things, bringing attention to the places where it needs to be, and instead of just individual birds out there, trying to do all of this on our own.
Nicely said. Thank you so much. Well, I'd like to talk for 1 second about, or maybe 30 seconds, about our Propel program, which I don't think I spent too much time talking about in the beginning. We are a hub for education, employment opportunities, training for peer providers in San Francisco, Alameda County, and in Marin County. And we are slowly but surely getting our network together. We had a convening a few weeks ago. We had a meeting, and we talked about, the theme was love yourself, how to take care of yourself so that you can lend support and help to others. And we had wonderful, Tracy Helton was one of our keynote speakers, and we had Sally Zinman as well as Eduardo Vega speaking to what they do for their self-care and some of their experiences. And in the afternoon, we had a training on compassion fatigue, and we got a lot of great evaluations. And it was the most important part of that, I think, was getting peers from other agencies together in a room, and there were about 50 of us, and it was fantastic to see that, peers doing all kinds of stuff, and, not just 2 or 3 over here in one agency and 3 or 4 over here in this agency, but together we made a beautiful murmuration of peers, I like to say. So that's our that's the conclusion. We do
have a question now.
Oh, okay, great.
You had mentioned peer certification, and so someone wanted to ask if you knew what was going on with the peer development of the peer certification and implementation, and is this going to be just for the mental health system? I guess you had talked about filing and answering phones, and they were thinking of, in mental health, working with clients and families.
Okay. Would somebody want to talk about peer certification? Julie or Tracy, or do you want me to?
Well, all I know about it is that from what I remember, we went to a convening of about a month ago on SB 614, which is the peer certification bill in California, and it's my understanding that it's kind of stalled. That may have changed because I overheard a conversation the other day, so I might have the details wrong, but somebody said it would be rolled out in 2017. I'm hopeful that that's the case. It would standardize peer certification and lend us a little more legitimacy, I believe. So we've been kind of pushing here at MHASF to try and help get people to reach out to their representatives in the legislature and whatever here in California to get them to kind of push that through and actually make it happen.
Yeah, one of the things we learned too was that California is one of 4 states that has not certified peers or standardized peer certification, which is pretty remarkable because California is usually, on the forefront of things. So we are very, very far behind. To get more information, you could go to CAMPHRO, CAMPHRO, because they're kind of leading the charge in, petition signing and letters to your reps and all that. They have all the templates and stuff to share. So if you want to get in touch with them, and I guess Kelly will add that to our PowerPoint here to send out. Oh, and sorry, the other question I wasn't sure, something about filing and telephones.
Oh, they were asking about the certification. Let's see, I asked because you were talking a lot about filing, answering phones, etc. When I think of working in mental health, I think of working with clients and families.
Yes, I think what we were talking about is that many times people come out of peer certification programs and they're placed in roles such as doing janitorial work or filing, doing administrative work, or food preparation. The programs don't really prepare people for those jobs. Most people who go to peer certification programs usually do want to do direct service. And so I think one of our challenges is, looking and creating more meaningful positions for peers in the workforce. But there are some people who do want to do those other jobs, which, as Derek said, that's absolutely fine. Whatever makes you happy. But for someone who really wants to provide direct service, it can be very frustrating to be placed in a job where you're filing or working in the back with charts when that's not really why you went to school to enhance your people skills, etc. I hope that answers the question or comment.
I think so.
Okay, so
Wonderful. Yes, they said thank you. Hello?
Oh, hello, Kelly?
Hi,
I
just want to remind... Oh.
Go ahead, sorry.
Oh, I just want to remind our audience members that our next PLI webinar will take place in 2 weeks on Thursday, March 17th, which is St. Patrick's Day. And this webinar will focus on the exciting and expanding role of the peer providers in integrated healthcare settings.
I want to thank everyone who's participated, all of my panelists, Kristen and Kelly, Julie, Derek, and Tracy, so much for your participation in this, and you in the audience. Thank you so very much.
Thanks, everyone.
Thank you.
Thank you, everyone, and this concludes our webinar.